here, we're going to take a look at the anatomy of a long bone.
The long bone is divided into three regions. The diaphysis is the shaft of the bone, which we're going to indicate here with some brackets. The ends of the bones are the epiphysis, again indicated with some brackets here. And you do have epiphysis at both ends. And then the metaphysis is going to be where the epiphysis joins with the diaphysis. So we'll take a look at this on an actual photograph of a bone. Here you're going to have your epiphysis, your diaphysis, and your metaphysis. On the ends of the bone, we're going to have articular cartilage. And so this is the slippery stuff that you're going to find on the end of a chicken bone. And the articular cartilage is made up of hyaline cartilage, which is going to allow it to be slippery and reduce friction in the joints. The periosteum is going to be the membrane that surrounds the outside of the bone. So all along the outside here, this is going to surround the entire bone. We're going to have periosteum. Inside the bone we have a cavity, the medullary cavity, that's going to have the yellow marrow in there, which is the fatty marrow. That is different than the red marrow, which is what we typically think of when we hear the term bone marrow. Right in there is where we're going to have the medullary cavity. The medullary cavity is going to be lined with endosteum, a membrane on the inside. And let's go ahead and make that one light gray, lining the inside. We're also going to have nutrient arteries that are going to come in through a hole called the nutrient foramen. This is going to supply blood to the diaphysis of the long bone. And then at the end of the bone, we'll have an epiphyseal artery that will supply blood to the ends of the bone. So on our picture here of a bone, you would have your arteries coming in at the end and one up a little bit higher on the shaft of the bone. We would have the articular cartilage in the places where we actually have the bone articulating. So this surface here would be covered with articular cartilage, as well as this surface here when it's in the body. So when we're looking at the compact bone, this is going to be the dense bone that we look at here. And we're going to have this all around the outside of the bone and through the shaft. So all of this area in here is going to be made up of compact bone. And then you're going to have a cortex, or a shell of it. It's going to go around the outside. Your spongy bone is where you're going to have the red marrow, and we'll have that be an orange. It's going to be found in the ends of the long bone. So if we look at this again on the picture of a bone, in this area here is where you're going to be finding a lot of that spongy bone, and then down in here, and then the high amounts of your compact bone throughout the shaft and around the edges of the bone. So this is your general anatomy of a long bone.